Hi everyone. As you can see, our session today is
Hi everyone. We'll probably be starting in just a minute when everybody's here, but today's presentation will be on mental health.
Yeah, and we do have a lot planned for today. I think most people have joined already, so if our volunteers want to take it away, you feel free.
Okay, we'll probably start off with the table of contents. First, we're going to have our introduction to mental health and mental illness, and then we will have types of disorders, and then we will talk about coping mechanisms and treatments. And then finally, we will wrap up with questions and the conclusion. Introduction.
So what is mental health? Mental health includes our emotional, psychological, also helps determine how we handle stress, relate to others, and on many factors. Over the course of your life, if you experience mental health problems, your thinking and mood and behavior could be affected. Some factors that contribute to mental health problems include biological factors, such as genes or brain chemistry, life experiences such as trauma or abuse, and family history of mental health problems.
Now we're going to talk about mental illness. Mental illness is a broad term that refers to conditions that affect your emotions, thinking, or behavior, or it can be a combination. Mental illness can impact daily interaction in your family, work, or other social settings. Mental illnesses are not something someone should be ashamed of, as they're just like any other medical condition. Mental illness conditions can be treated and managed. Also, mental illnesses can impact different people differently. Some are mild and only interfere a little with their daily life, while others can be so severe that a person may need care from the hospital. Here are some statistics. Mental illnesses are quite common. About 19% or 1 in 5 people mental illness and mental health are not opposite ends of a spectrum. Someone can have poor mental health but not have any mental illness. It's even possible to have good mental health with a diagnosis of a mental illness. However, mental health issues can lead to mental illness. For example, lots of stress for a long time can lead to anxiety or depression. Next, we're going to types of
Hi everyone, today we're going to be talking about generalized anxiety disorder. So, start off with the basics. What is anxiety? Anxiety is a feeling of worry or uneasiness about something or something with an uncertain outcome. I'm pretty sure all of you have experienced anxiety in your life before, like maybe in school or in social situations. But this type of anxiety is normal and this goes after a while. But sometimes this anxiety could get out of control and could become a disorder. There are 5 types of these anxiety disorders. In this slide, we'll be talking about generalized anxiety disorder. In generalized anxiety, a person has an excessive and persistent anxiety about everyday life events. People with anxiety disorder may anticipate disaster and may be overly concerned about money, health, family, work, or other issues. They may worry about a certain situation or event when there's no apparent reason for concern. Here are some of the symptoms that people with generalized anxiety disorder experience. The first one is restlessness, trouble sleeping, faster heart rate, nausea, headaches, and more. Some causes that cause generalized anxiety disorder is genetics. Having a family member with generalized anxiety disorder increases your risk. Brain chemistry and environmental factors such as the death of a loved one, being in the military, divorce, or other traumatic events could cause this. You might be wondering if there's any cure for generalized anxiety disorder, but unfortunately there's no cure, but there's therapy that might help. In cognitive behavior therapy, the therapist and the person will work together to recognize patterns and behaviors that lead to anxious feelings. Then they try to limit the distorted thinking and think by looking at the worries in a more realistic way. The other treatment option is medications. A doctor may prescribe a type of drug called benzodiazepines. They help relieve intense feelings of sudden anxiety. They work by relieving the physical symptoms of anxiety, such as muscle tension and restlessness. Some common drugs that are benzodiazepines are Xanax, Librium, Valium, and Ativan. As these drugs could be highly addictive, they're used in very severe cases. That's it for generalized anxiety disorder. Next up, we're going to be talking about OCD, another type of anxiety disorder.
OCD is an anxiety disorder in which people have recurring unwanted ideas or sensations, known as obsessions, that make them feel driven to do something repeatedly, known as compulsions. This disorder can significantly interfere with a person's daily activities and social interactions. OCD obsessions are intrusive and cause distress or anxiety. Common themes include fear of contamination, needing things to be orderly, or aggressive thoughts about losing control and harming yourself or others. You might try to ignore them or get rid of them by performing a compulsive behavior or a ritual. Compulsions are repetitive behaviors that you feel driven to perform. These repetitive behaviors or mental acts are meant to reduce anxiety related to your obsessions or prevent something bad from happening. However, engaging in compulsions brings no pleasure and may offer only temporary relief from anxiety. These compulsions are excessive and often not realistically related to the problem they're intended to fix. Common themes include washing your hands until your skin becomes raw or checking doors repeatedly to make sure they're locked. The causes of OCD are not fully understood, but there are several theories. First, many people believe that compulsions are learned behaviors, which become repetitive and habitual when they are associated with a form of relief from anxiety. The second theory is that OCD is due to genetic factors, and lastly, chemical structure and functional abnormalities in the brain are one of the main causes. OCD is common in older teens and younger adults, but it's also common in people who have other mental or neurological conditions. So what are some treatment options? Well, first, psychological treatments such as cognitive behavioral therapy, anxiety management techniques, support groups, or medications are some options. So that's all for OCD. Now on to PTSD.
Now we move on to post-traumatic stress disorder, also known as PTSD, which is a mental health condition triggered by a terrifying or traumatic experience either through witness or experience. PTSD has 4 categories of symptoms, but I'll only be going over 2, which are easier to recognize than the other 2. The first is intrusive memories, which involve unwanted memories coming back, either in a nightmare or just randomly, and distress from something reminding of a traumatic event, such as high-pitched noises reminding of shell shock. The other category is negative changes in thinking and mood. This is simply feeling down and having negative thoughts such as hopelessness, negative thoughts about self, world, and others. This can sometimes lead to suicidal thoughts. Most people know the cause of PTSD, witnessing or experiencing a traumatic event. This experience can be something such as war, battle, or anything traumatic. There are many risk factors. These can be personal and family history of mental illness, substance misuse such as alcohol or drug use, lacking strong support from family and friends, genetics, these are inherited risk and personality features, and the biggest, having a job that increases the risk of experiencing such an event, such as a soldier or any high-risk job, such as a firefighter. Treatment is much like other mental disorders. These are psychotherapy, also known as talk therapy, where you have one-on-one sessions with the therapist, or maybe group sessions, and antidepressants. That's it for PTSD. Now on to panic disorder.
Okay, hello everyone. We will now be moving on to panic disorder. So panic disorder is a type of anxiety disorder that occurs when someone experiences recurrent unexpected panic attacks. And panic attacks are sudden episodes where someone experiences extreme fear even when there's no real danger or if there's not an obvious cause. Panic attacks can trigger severe physical reactions, including a racing heartbeat, nausea, sweating, chills, difficulty breathing, and dizziness. One more thing to mention is that many people will experience 1 or 2 panic attacks in their life, and then the problem will go away. But panic disorders, when these panic attacks are reoccurring and unexpected. The cause of panic disorder is unclear. However, factors like genetics, a major life change that creates stress, or more sensitive temperament that is prone to negative emotions could also play a role. Moving on to risk factors, like I said before, it could be linked to genetics, so having a family history of panic disorder, major life stress, smoking or excessive caffeine intake, and a history of abuse can be risk factors. One more thing to note is that it's more common in women. Some treat exercises and medications. Okay, so that's all for panic disorder.
Next, we'll get into mood disorders. A mood disorder is a disorder that specifically impacts someone's emotional state. One of the mood disorders is depression. Depression is a mental health disorder characterized by constant feelings of sadness and loss of interest, which have a huge impact on daily life. Symptoms of depression include persistent sad moods, feelings of hopelessness, decreased energy, irritability, feeling restless, difficulty concentrating, thoughts of death or suicide, loss of interest in hobbies, difficulty sleeping, and more. Depression symptoms can be very severe, affecting your thoughts, feelings, and daily activities, for example, going to school. Depression can be caused by brain chemistry, hormones, inherited traits, biological differences, or it can be triggered by traumatic events such as divorce or illness. Additionally, there are risk factors for depression, including certain personality traits such as low self-esteem or being too self-critical. Some other risk factors are blood relatives with a history of depression, history of other mental health disorders, abuse of alcohol or recreational drugs, serious or chronic illness, and certain medications. The last risk factors being lesbian, gay, bisexual, transgender, or intersex. The most common treatments for depression are medications or psychotherapy. These medications are called antidepressants, and there are many different types of antidepressants. Psychotherapy, on the other hand, is essentially talking about it with a mental health professional. Lastly, here are some statistics. Out of children's ages 3 to 17, 1.9 million have diagnosed depression. Major depressive disorder affects about 17.3 million American adults, which is 7.1% of the U.S. population ages 18 and older. Now we'll be moving on to another mood disorder, seasonal depression.
Hello everyone, now let's talk about seasonal depression. Have you ever heard of the phrase winter's blue, where you feel a bit sadder than the previous seasons? Well, seasonal depression is somewhat similar to that common phrase. Seasonal depression, also known as seasonal affective disorder, is a type of depression that occurs in specific seasons. Seasonal depression has 2 types: fall-winter seasonal depression, which is the most common one, and spring-summer seasonal depression. However, what causes depression to occur from season to season? Sadly, there's no definite cause of seasonal depression. There are some theories about a decrease in sunlight causing seasonal depression. Without sunlight, your serotonin levels drop, which is responsible for your happiness, your melatonin increases, making you sleepier, and your body's clock changes, affecting your behavior or mood. Now, what are some symptoms of seasonal depression? Most people with seasonal depression have depression for prolonged periods throughout the day, have low energy or interest for things they used to like, have sleeping problems, changes in weight or appetite, feeling a bit more agitated, or feeling a bit more anxious. Within the specific types of seasonal depression, people with fall-winter seasonal depression tend to have symptoms of oversleeping, tiredness, weight gain, or appetite changes. As for spring-summer, people may have insomnia, poor appetite, weight loss, or anxiety. Although some populations are at more risk to developing seasonal depression, people who have a history of seasonal depression, mood disorders, mental conditions, and live further away from the equator, aka getting less sun, are at more risk. Also, seasonal depression is more common in younger populations and in women. As you visit your doctor about seasonal depression, they may diagnose you in a combination of ways. Your doctor may conduct lab tests to eliminate other conditions that are similar to seasonal depression. They may also use thorough psychological evaluations or the DSM-5 manual, which lists out criteria for mental disorder, to analyze whether you have depression and whether it correlates with seasons. After it's confirmed that you have seasonal depression, your doctor may approach your conditions in various ways, depending on your pre-existing mental conditions. For instance, they could use medications such as antidepressants or recommend some mind-body connection techniques like yoga. Light therapy, where you're exposed to light through a light box, or exposure to sunlight could help your mood, although it's not recommended for people with bipolar disorders. Lastly, don't overlook your winter's blue as something that will pass. Seek professional help if it's starting to affect your life or goes on for prolonged periods. Now, let's go on to bipolar disorder.
Right, so now we'll be moving on to bipolar disorder. All right. Right, so what has been, wait, sorry. Okay, so bipolar disorder, also known as manic depression, is a mental disorder that causes unusual shift in mood, energy, activity levels, concentration, and the ability to carry out day-to-day tasks. There are 3 types of bipolar disorder. All types involve clear changes in mood, energy, and activity levels. These mood ranges from periods of extremely up, elated, irritable, or energized behavior, known as manic episodes, to very down, sad, indifferent, and hopeless periods, known as depressive episodes. Less severe manic periods are known as hypomanic episodes. The 3 types include bipolar disorder, which includes manic episodes that last at least 7 days, and depressive episodes, usually lasting at least 2 weeks. Bipolar II disorder, which is similar to the first, except not as full-blown, and psychodymia disorder, which is a lot more extreme. It is defined by periods of hypomanic symptoms as well as periods of depressive symptoms lasting for at least 2 years. Although the exact cause of bipolar disorder is typically unknown, it is widely believed that it is the result of chemical imbalance in the brain, as well as being the result of genetics. If someone in your family has or has had a history of bipolar disorder, you may be at risk than others. Symptoms of this disorder includes mania or hypomania and depression, but it can also include things such as anxious distress and others. Although bipolar disorder usually requires lifelong treatment and can't be fully extinguished, taking medications and going to psychotherapy can help. Certain medications can help manage symptoms of bipolar disorder. Some people may need to try several different medications and work on their healthcare provider before finding medications that work best. Medications generally used to treat bipolar disorder include mood stabilizers and second-generation antipsychotics. Treatment plans may also include medications that target sleep or anxiety. Healthcare providers often prescribe antidepressant medications to treat depressive episodes in bipolar disorder, combining the antidepressant with a mood stabilizer to prevent triggering a manic episode. If you want to stop taking medications, make sure to speak with your healthcare provider first, as suddenly stopping can lead to a rebound or worsening of bipolar disorder symptoms. Psychotherapy, also called talk therapy, can be an effective part of treatment plan for people with bipolar disorder. Psychotherapy is a term for a variety of treatment techniques that aim to help a person identify and change troubling emotions, thoughts, and behaviors. It can support education and guidance to people with bipolar disorder and their families. Treatments may include therapies such as cognitive behavior therapy and psychoeducation, which are used to treat a variety of conditions. And that's it for bipolar disorder. We'll be moving on to the next slide.
All right, so we'll now be talking about eating disorders. Eating disorders are medical conditions where a person develops unhealthy eating habits, which can be caused by genetics, brain biology, personality traits, and cultural ideals. However, in popular culture, eating disorders are often shown to be caused by peer pressure and social anxiety. Eating disorders can become serious when it causes health problems or emotional distress on a person. Eating disorders are more prevalent in women, especially teens and young adults. However, they can affect almost anyone. There are 6 distinct types of eating disorders. We'll be talking about all of them today. The first eating disorder we'll talk about is anorexia. Anorexia is probably the most well-known disorder. People with anorexia nervosa think of themselves as overweight, though they may be the opposite. Symptoms of anorexia nervosa include being very underweight, obsessing over food intake and dietary patterns, body image problems, or limiting food intake or purging food through vomiting, taking laxatives, or extreme diets. Certain people are most likely to develop anorexia, especially those with a family history, a history of diets, a need for perfection or body image dissatisfaction, and peer pressure. Anorexia nervosa is especially difficult to treat because many people with anorexia don't believe they have a problem. The most common treatments are therapy to help change unhealthy thoughts and habits and to deal with emotional strain, and medications to deal with anxiety and depression. Before we end, here are some statistics about anorexia. 9% of American women will suffer from anorexia in their lifetime. Also, about 1 in 5 anorexia deaths is by suicide. So yeah, thank you. We'll now move on to bulimia.
Now we'll be moving on to bulimia, another type of eating. Bulimia is an eating disorder in which people have episodes of binging, meaning that they eat a lot of food in a short period of time, and these episodes are followed by purging, meaning throwing up food, or other methods to avoid weight gain, such as overexercising or fasting. Avoiding weight gain after binging, such as forcing yourself to overexercise, throw up your food, fast, or take laxatives, is a symptom of this eating disorder since people with bulimia often fear weight gain. Some other symptoms include having a negative body image and wanting to change the way you look, going to the bathroom right after eating to throw up food, not wanting to eat in front of others, and having a constantly changing weight. There are some other physical symptoms of bulimia as well. Swollen glands in your neck and face may occur if you have bulimia due to dehydration from throwing up food. Not taking proper care of your body and using unhealthy methods to force yourself to lose weight can also result in always feeling cold, dizzy, and weak. Like all eating disorders, bulimia is complicated and not fully understood. However, it is known that there are some risk factors which increase the chance of one developing bulimia. These risk factors or causes of bulimia include stressful situations, traumatic events, low self-esteem, dieting, and having other psychological disorders such as PTSD, anxiety, depression, and OCD. While eating disorders are hard to deal with, recovery is possible and there are treatments to help aid this. Medications such as antidepressants aid with treatment and reduce symptoms of bulimia. Hospitalization is usually rare for those with bulimia, but if symptoms are very severe, then hospitalization would be used to treat the individual. Therapy is also a way to treat bulimia. There are different types of therapies that would be used, and these include cognitive behavioral therapy, family-based treatment, and nutritional therapy. In therapy, those with bulimia would learn triggers, how to take care of their bodies, and challenge unhealthy behaviors. Now, here are some statistics about bulimia. It is estimated that around 4% of American women will develop bulimia at some point in their lives. Out of those who develop bulimia, it is estimated that around 3.9% will lose their lives due to this eating disorder. That was all for bulimia. We will now be moving on to binge eating disorder.
Binge eating disorder consists of frequently consuming unusually large amounts of food in one sitting and feeling that eating behavior is out of control. There are a variety of emotional, behavioral, and physical symptoms. Some emotional and behavioral symptoms include extreme concern with body shape and body weight, disruption in normal eating behaviors, eating alone out of embarrassment at the amount of food being eaten, feelings of disgust, depression, or guilt after overeating, fluctuations in weight, and feelings of low self-esteem. In addition, some physical symptoms include stomach cramps, other non-specific gastrointestinal complaints, and difficulties concentrating. Those who suffer from emotional disorders are more likely to develop eating disorders. In addition, weight fluctuations, dieting, body image concerns, genetics, and a family history of eating disorders may result in a higher chance of binge eating disorder. However, there are causes that aren't due to underlying disease. Examples include eating too much at holiday celebrations or in preparation for an athletic event such as a marathon. You should see a doctor when binge eating is regular and excessive or when your physical and mental health are affected. Binge eating disorder is typically diagnosed psychologically through a discussion of your habits. However, consequences of binge eating disorder include high cholesterol, high blood pressure, heart problems, diabetes, and some sleep-related breathing disorders. You may have to complete tests to assess these risks. These tests include but are not limited to a physical exam, blood and urine tests, and a sleep order center consultation. Treatment of binge eating disorder may require a team approach that includes doctors and other medical care providers, mental health professionals, and dietitians with experience in eating disorders. Treatments include psychotherapy, medication, lifestyle, and home remedies. Psychotherapy is kind of like talk therapy, and they teach you to exchange unhealthy habits for healthy ones and reduce binging episodes through individual and group sessions. The next type of treatment is medication. Some medications that are used to treat ADHD and seizures have been proven to be helpful in controlling binge eating disorder. Antidepressants have also been helpful, but medical professionals aren't sure how it works. And some statistics are that binge eating disorder is 3 times more common than anorexia and bulimia combined, and that less than half of people with binge eating disorder will receive treatment.
Orthorexia is an eating disorder that focuses on healthy eating too much. Symptoms of this eating disorder can be worrying too much over the quality of what you eat. Another symptom is avoiding eating outside or eating food that other people make for you, as you might be afraid that the food you don't prepare won't meet your standards. A person with orthorexia can be afraid of developing sickness from food and worrying that the food isn't clean or that it's bad for their health. Physical signs of malnutrition can also come up, and because a person with orthorexia might not be able to receive the proper amount of nourishment from the food that they eat, this may result in weight loss. Another symptom can be overly researching too much about the food that you eat. A person with orthorexia can spend hours thinking about food or planning what to eat. And a person with orthorexia could decide to stop eating whole categories of food, such as grains, gluten, or sugar. A symptom is fearing that you might lose control over what you eat and be afraid that even eating one meal at a restaurant or one that you didn't prepare will have disastrous results. And you can also be overly critical of what your friends or people you know eat. Risk factors and causes of orthorexia can be different with every person, but there are mainly 3 categories of risk: biological risks, psychological risks, and societal risks. Biological risks can include having a relative with an eating disorder or with type 1 diabetes, while psychological risks can be perfectionism, being dissatisfied with your body, or having a history of anxiety. And finally, societal risks include having been bullied about your weight or how your body looks, family trauma spreading through generations, or hearing about and having an obsession with a perfect or ideal body. A doctor may tell you to use the 4 following treatment methods. The first is preventing exposure and response. The more that you are exposed to something that makes you upset or anxious, you may start to react less to it. The second is changing your behavior. Telling yourself the negative effects of what you're doing can help you change your habits. Cognitive restructuring can help you identify habits that make you stressed and replacing them with better actions and habits. And finally, forms of relaxation like meditating, yoga, and Tai Chi can help. Bigorexia is a health condition that makes you think that your body is too small or not muscular enough, and that may lead to obsession with constantly building muscle. Some symptoms of bigorexia tend to be obsession with your appearance and building muscle, focusing on diets that help you lose weight and primarily gain muscle, using medications and steroids that relate to physical fitness, and being unsatisfied with your body. If it's left untreated, bigorexia could end up leading to steroid misuse, suicidal thoughts, and depression. While causes of bigorexia aren't confirmed, Some known risk factors might be bad experiences during childhood, having been bullied about weight, and people who are into bodybuilding and wrestling can be more at risk. Statistics show that 22% of males and 5% of females have eating behaviors that are related to physical fitness. Possible treatments include self-care, limiting exercise to 30 minutes daily, stopping the use of steroids, protein drinks, and fitness supplements, and to stop using fitness or calorie trackers. Other behaviors such as purging, binge eating, smoking, and alcohol use may add to bigorexia, so it's important to address those behaviors. Next, we'll be moving on to
Can you switch the slide? What is body dysmorphia? Body dysmorphia is a mental disorder that is focused around disliking your own image. This affects 1.7 to 2.9% of the general population. While that seems like such a small and insignificant number, approximately 5 to 10 million people are affected in the US alone. This can be confused with simple insecurities, but it becomes a mental disorder when it disrupts the way you live your life. Signs and symptoms include frequent thoughts about your appearance, at least an hour a day, spending a lot of time staring in a mirror and or reflective surface while fixated on the perceived flaw, or in some cases, complete avoidance of mirrors or reflective surfaces, covering up the disliked body area, for example, using hats, scarves, makeup, body position, or posture, and repeatedly asking others if you look okay, also referred to as assurance seeking. What are the risk factors and causes? Researchers believe that genes, serotonin, and brain differences all contribute to body dysmorphic disorder, BDD. Treatment options are cognitive behavioral therapy, CBT, and SSR medicines, which are medicines that help serotonin, as well as time and support. Now, let's move on to psychotic disorders.
Now let's learn about psychotic disorders. A psychotic disorder is a mental disorder where one disconnects from reality. There are many different types of psychotic disorders, such as schizophrenia, which is the most common psychotic disorder, schizoaffective disorder, schizophreniform disorder, brief psychotic disorder, and many more listed on the screen. Symptoms of psychotic disorders include disordered forms of thinking, loss of interest, hallucinations, delusions, possibly dangerous and strange behavior, confused thinking, incoherent speech, the inability to express emotion, and many more. The standard diagnosis for a psychotic disorder is a doctor performing a physical exam, checking medical and psychiatric history, and possibly referring them to a psychiatrist or psychologist if not finding a physical reason for the symptoms. Psychiatrists and psychologists then typically use different assessment tools to diagnose the patient. Looking at psychotic disorders from a more outside perspective, there are many misconceptions, myths, and stigmas around mental health, and especially psychotic disorders. For example, some people believe that people with these disorders are inherently violent. Some people believe that those with severe mental illnesses, like schizophrenia, behave more dangerous. However, this is a complete myth. Statistics show that those with schizophrenia behave more frightened and confused instead of violent. Incidences of people with brain disorders that behave violently are not much higher than the general population. It's important to become educated on these disorders and never assume anything. Those that feel like they need help should reach out and seek treatment and not fear being treated differently. Now let's move on to a specific psychotic disorder, schizophrenia. Schizophrenia is a serious mental disorder in which people interpret reality abnormally. Schizophrenia involves a range of problems with thinking, behavior, and emotions. Signs and symptoms may vary, but usually involve delusions, hallucinations, disorganized thinking and speech, disorganized or abnormal motor behavior, and negative symptoms. The term negative symptoms refers to reduced or lack of ability to function normally. An example is neglecting personal hygiene. It's not known what causes schizophrenia, but researchers believe that a combination of genetics, brain chemistry, and environment contributes to development of the disorder. Although the precise cause of schizophrenia aren't known, certain factors seem to increase the risk of developing or triggering schizophrenia. These risk factors include family history, pregnancy and birth complications, and mind-altering drugs.
Hello, so now we will move on to maladapting coping mechanisms. Firstly, a coping mechanism is like the way we deal with something, usually something that has a negative impact on our life. These can be good and healthy, but they can also be extremely harmful and unhealthy, which are called maladapting coping mechanisms. They are seemingly short-term coping mechanisms that are harmful in the future. Some examples of them would be self-harm, such as cutting or eating disorders. Say someone was made fun of for their body at school. A way they might cope would be changing their diet in a negative manner to try to change their body. They think this is working, as their body would change, thus making it a short-term solution, but it really isn't. It is only harming them and can further develop into an extreme eating disorder. Other examples would be taking drugs to numb the pain in the moment, but it will really just result in messing up their body and their brain. There are also coping mechanisms such as overspending or just buying excessive amount of things, perhaps to distract one from their issues, but in the future it will just result in them being financially unstable. There are also mechanisms such as recklessness in terms of sexual behavior or overall behavior, but those just aren't very helpful. All of these things have one thing in common. The person that is doing them thinks it's helping them, as it makes them feel better in the moment, but eventually it's really just going to harm them. So why do we do them? Why do these habits develop? Well, with the countless types of curveball life throws at everyone, and will continue to throw at everyone, it doesn't take much for them to develop. When something messes up our life, such as a loved one's death, not getting into a dream college, being broken up with, or just all this COVID, we get sad, stressed, depressed, lonely, just all of these negative emotions start to take over, and we need something to be in our control. We need something to help, and that's when these harmful habits develop. This is why it's really important to check in with people when they're going through a hard time, or just in general, just knowing someone's there for you can really help. Now, Crystal will talk about good coping mechanisms.
Right. So now we'll be going over good coping mechanisms. So there are two main types of coping skills, which are problem-based and emotion-based. Problem-focused coping is helpful, especially when you want to change your current situation. For example, unhealthy relationships. Here's a list of problem-focused coping ideas. Asking for support or speaking with a friend or professional regarding your conflict and situation. Creating a to-do list to get you motivated and having a clear idea of your direction. Establishing healthy boundaries. Walk away or say no to situations causing you stress if possible, and working on time management, such as setting up alerts and planning ahead of time. Emotion-focused coping is helpful, especially when you are feeling lonely, sad, or angry. Here's a list of emotion-focused. Keeping your space clean and organized, doing relaxing hobbies or events such as drawing, coloring, or yoga. Drinking tea can also help relieve your stress. Listening to music can make you feel like you're in another dimension and away from reality. Reading a book, listing things you're grateful for, and more. Here are just some of the few I listed above, but please keep in mind there are definitely more out there. Lastly, take time to rethink and reevaluate yourself. Think about how far you came in life and what goals you want to set for your future self, as it may motivate you. All right, now I'll pass on to Rowan and to explain to you guys how coping mechanisms and treatments work.
Now that you know a few coping mechanisms, let's go over some treatments and how they work, along with how some coping mechanisms work. Let's start off with psychotherapy. There are many forms of psychotherapy, including but not limited to cognitive behavioral therapy, talk therapy, exposure and response therapy, and art and sand therapy. Therapies like talk therapy often allow a therapist and sometimes a psychiatrist to work with the patient and give advice for whatever the patient needs to be mentally, emotionally, and physically safe and happy. When you work with a therapist or a mental health professional, it helps form healthy pathways in your brain that make you more inclined to respond logically and safely to a stressful environment or situation. Someone in therapy for trauma or a trauma-based disorder can also work with a therapist to understand their trauma and learn to get through and cope with the effects of it. Next, let's move on to medication. Medication for mental illnesses can include things like anti-anxiety medication, antidepressants, and antipsychotics. Medication can help balance out any chemical imbalances in your brain and help stabilize your mood and make your thought process more rational and less anxious or disconnected from reality. Medication is usually combined with a form of therapy, and medication is prescribed and monitored by a psychiatrist. Remember Dr. Green, who spoke in an earlier session? That's her job as a psychiatrist, to monitor, diagnose, and prescribe medications to people who need them for mental health. Moving on, exercise and physical activity can also be a healthy coping mechanism for a lot of people. Exercise can serve as a distraction or grounding technique for people who are anxious or just want to get out of their head for a little bit and focus on something else. Exercise has also been proven to improve mood and mental health and can actually lessen some symptoms of depression and anxiety. But remember that exercise needs to be in moderation. Over-exercising is very dangerous and does more harm than good, both mentally and physically. Also, make sure that you aren't exercising as a compulsion or if you are struggling with eating too little. Some signs of compulsive exercise include feeling guilty or anxious if you don't exercise, continuing to exercise even if you're injured or sick, if your friends or family or provider are worried about how much you exercise, if exercise is no longer fun, or if you skip work, school, and social events to exercise, or if you stop having periods when you're meant to. Finally, let's move on to psychiatric hospitalization. Despite what a lot of movies, TV shows, and video games show, psychiatric facilities don't look like this, and the trope of mad scientist experimenting on chained down crazy person is not what you'd see if you visited a real mental facility. For example, here is Parkside Psychiatric Hospital and Clinic in Oklahoma, United States. Here's the inside. Psychiatric hospitalization usually only occurs when the patient is deemed a danger to themselves and/or others and needs serious treatment. Psychiatric hospitals have psychiatrists, therapists, and nurses monitor patients, and there are measures taken to prevent any way they could injure or trigger themselves. Psychiatric hospitals help patients by diagnosing them and helping them get through their problems with things like monitored medication, therapy, and taking away stress and risk factors. Many people who are admitted to psychiatric facilities end up going on medication, working with a therapist or psychiatrist long-term after being discharged once they're stable. Let's move on. Does anyone have any questions?
I think there were a couple of questions in the chat. One of them is there a disorder for feeling like no guilt? I think, like we mentioned when we talked about different disorders, guilt is a part of the symptoms or causes of it. So like, just like what Rowan mentioned about guilt, and then also for like a lot of the eating disorders, people feel guilty for eating a lot. So I don't know if guilt itself is a disorder, but it is a part of disorders.
There are some personality disorders where you don't feel as much guilt or you don't feel as much like emotion or empathy, something like sociopathy, but we didn't go into that in this presentation because it would have been too long and it might be a little complicated. But if you want to do research on that on your own, just try to go to like verified websites, usually that end in like .org or .edu, so you're not looking at false or dangerous information.
Yeah, definitely. And then I can enable the chat right now. You guys can type in questions, have them. Yeah, but in the meantime, if Rowan or Crystal want to go over social media and our future sessions, I can switch to the slides.
Yeah, so if you guys haven't, please follow our Instagram at Youth and Pre-Med and also check out our website. Also, if you have any questions or want to email us, you can email us at youthandpremed@gmail.com. And here is I'll paste in the chat. Oh, never mind. It's in the chat now. All right, thanks, Rowan. And that's in the chat, so take time to look through it. All right, so thank you so much for joining today's session. We really appreciate it. Our next session will be on May 16th, and the topic will be on surgery. So I'm hoping to see you guys there. And I think that's about it for today, right?
Yeah, so next week on the 9th, we won't be having a session because it's going to be Mother's Day. So take the time to spend time with your family, with your moms, and then we'll resume on May 16th. And I know a lot of people want to play Kahoot, so we'll try to make one for the session on the 16th. And yeah, like Rowan said, we will be sharing some polls and quizzes on the Instagram story. Okay, thank you so much for coming, guys.